Bloodborne pathogens, BBPs, are microorganisms that can cause disease in healthy human beings when exposed through a fluid exchange. Examples of disease include malaria, syphilis, hepatitis, and acquired immune deficiency syndrome, AIDS. Bloodborne pathogens can present in both blood as well as other potentially infectious materials, or OPIM, such as body fluids, cells, tissues, and organs of human origin. The Bloodborne Pathogen Standard is a set of regulations passed by the California Occupational Safety and Health Administration, Cal-OSHA, as well as the Federal Occupational Safety and Health Administration. The UC Davis campus adheres to the Cal-OSHA standard as it is more stringent. The purpose of the Bloodborne Pathogen Standard is to reduce or eliminate the risk of occupational exposures and to prevent disease if an exposure occurs. This standard applies to all work where occupational exposure to human blood or other potentially infectious material is reasonably anticipated. Review this standard online at the California Code of Regulations website or Guidance and Expectations of Workplace with Human Bloodborne Pathogen Exposure Risk. Bloodborne pathogens include viruses, bacteria, parasites, and prions, all of which can be transmitted through fluid exchange and may lead to disease. We will next discuss characteristics of HIV and hepatitis B and C, as they are the most commonly occurred bloodborne pathogens. Provided here is information regarding the epidemiology of HIV, hepatitis B and C, as well as potential treatment options after infection. Click the tabs at the top to learn more about each item. Here's the epidemiology of the three most common bloodborne pathogens. HIV is a relatively fragile virus that can only exist outside of the host for 4 hours or less. However, it is a lifelong disease. HBV is a resilient virus that can live up to 14 days outside of the host and remains infectious even in dried blood. HCV affects a large patient population of unknown status, and samples may unknowingly be affected. Symptoms of acute infection with all of these viruses initially present with mild flu-like symptoms: fever, headache, fatigue, loss of appetite, and general malaise. No known cure for any of these diseases. Prophylactics available for HIV and HCV, vaccines available for HPV. Each can have long-term effects. HIV can progress to AIDS. HBV/HCV can lead to liver disease and cirrhosis. A key component of the Cal-OSHA Bloodborne Pathogen Standard is the requirement that all research laboratories maintain a Bloodborne Pathogen Exposure Control Plan, a BBP-ECP. At UC Davis, a BBP-ECP is kept and maintained by each laboratory that works with human cells or tissue. You should be trained on this written plan prior to working with materials that may contain BBPs. The exposure control plan should be reviewed at least annually or as the risks, job duties, or health status of employees change. Key components of the BBC-ECP are listed here. The first step in developing a BBP-ECP is forming a determination of the potential BBP risks that may be present in the laboratory. This starts with the identification of potential sources of bloodborne pathogens and understanding the common modes of transmission of BBPs within the workplace. Bloodborne pathogens can be transmitted through unfixed human blood, body fluids, cells, tissues, or organs. Body fluids such as feces, nasal secretions, sputum, sweat, tears, vomit, urine, and saliva are not included unless they are visibly contaminated with blood. However, saliva from dental procedures is considered an OPIM. It's important to note that bloodborne pathogens are one example of biohazardous infectious agents that are capable of causing disease in healthy human beings. You can get infected from biohazardous materials other than blood or body fluids. This includes airborne or direct contact with infectious substances, These risks are covered in other biosafety training courses. Bloodborne pathogens can be transmitted through contact with contaminated sharps, needles, or cuts from sharp objects that have punctured the skin. They are also commonly transmitted through direct skin contact via moist mucous membranes, such as the eyes, mouth, and nose, and non-intact skin, such as open cuts or sores, acne, or blisters. It's important to note that bloodborne pathogens cannot be transmitted through casual contact because the skin is generally intact. Ingestion can also occur through mouth pipetting, eating or drinking in the laboratory, or placing contaminated fingers or items in the mouth or lips. This includes pencils or even cell phones. Remember that in order to form a lab-specific BBP, ECP, you should perform a risk determination of your experimental studies to understand the potential biohazardous risk of working with materials that may contain bloodborne pathogens. This includes recognizing sources of BBPs, modes of transmission, signs and symptoms of BBP infection. Once the risk of occupational exposure to BBPs has been determined, these hazards should be identified within the lab and labeled in order to communicate the potential hazards. Next, to develop a lab-specific BBP ECP, you must identify the operations within the lab that could result in occupational exposure. With the risky procedures identified, the laboratory must implement controls to eliminate or mitigate these risks. You will know if something is potentially hazardous because it will be communicated with these signs or labels. Areas that may harbor biohazardous agents are labeled with a fluorescent orange or orange-red color, marked with the word biohazard in contrasting letters and the universal biohazard symbol. Biohazardous agents are not visible to the naked eye. Adhere to these warning symbols, which alert you to take precautions around areas where bloodborne pathogens may be present. It is critical that you ensure that your areas and equipment are appropriately labeled to provide hazard communication to others. Label potentially infectious material with a biohazard symbol. This includes refrigerators, freezers, waste containers, transportation containers, and doors to areas where bloodborne pathogens are handled. Also ensure that you label the area where potentially infectious materials or contaminated linens and other debris that have not been disinfected. There are various tasks that involve reasonably anticipated occupational exposure. In formulating a lab-specific exposure control plan, analyze which of your operations could result in an occupational exposure so that you can take measures to mitigate these risks. In particular, follow precautions whenever handling medical waste, syringes, needles, or sharp objects, blood, bodily fluids, or other potentially infectious materials, emergency response activities, or whenever you engage in a spill cleanup which involves splashes or splattering. BBPs are transmitted via a fluid exchange, so it is imperative to define experimental procedures that could result in the generation of splashes, sprays, or aerosols. Some common laboratory procedures are listed here. Once these higher risk operations are identified, controls should be implemented to reduce or mitigate the risk of an occupational exposure due to splashes, sprays, or aerosols. The common methods of compliance used to prevent exposure to bloodborne pathogens follows the hierarchy of controls, which are elimination, substitution, engineering controls, administrative controls and work practices, and personal protective equipment, or PPE. Not all control measures provide the same level of protection. In order of effectiveness, engineering controls, such as safety equipment, afford reliable protection, followed by administrative controls, such as work practices, safety rules, standard operating procedures, or training. Personal protective equipment, such as safety eyewear, gloves, and laboratory coats, are considered the least preferred defense against hazards. Although PPE should always be used as prescribed, avoid relying on PPE as the only method of protection. Engineering controls are utilized to isolate or contain BBPs, mitigating the risk of a bloodborne pathogen exposure through the use of safety equipment. Some examples include the use of a certified biological safety cabinet results in HEPA filtration of any biohazard aerosols generated during the research with the BSC. Use of a splash shield provides a protective barrier against splashes between the worker and the potentially infectious material. Safer sharps devices, such as needle guards or retractable syringes, should be used to minimize accidental needle sticks. Aerosol-tight centrifuge cups and rotors should be used to contain aerosols generated during centrifugation. Additionally, mechanical devices should be used whenever possible to avoid direct contact with infectious materials. The majority of occupational exposures to bloodborne pathogens are caused by contaminated sharps cutting or piercing the employee. In developing your lab-specific BBP, ECP, and defining sharps operations, you should look to eliminate or substitute whenever possible. Substitution can include switching from glass to plastic products, using disposable sharps, or utilization of a safer sharp alternative, like those pictured here. In order to reduce an experimental sharp's risk, you should look to either create distance between your hands and the sharp instrument, or reduce the time that the sharp risk is present, especially once it's contaminated. Many safe sharp alternatives employ retractable or shielding technologies that have proven to significantly reduce the number of occupational bloodborne pathogen exposures, particularly in hospital and clinic settings. Before using disposable sharps, remember to place an appropriately sized sharps waste container within arm's reach of your experiment. It is important to watch each sharp go into the waste container, as exposures often occur when workers miss the opening because they took their eyes away from it. Further, when using a significant number of sharps, working for long periods of time, or performing repetitive sharps operations, it is critical to take short, frequent breaks in order to stay focused and avoid hurried or complacent behaviors. Administrative and work practice controls are designed to reduce the likelihood of exposure by defining the manner in which tasks are performed. Some examples include obtaining authorizations or approvals before working with biohazardous materials, such as biological use authorization. Follow basic laboratory precautions, such as no eating, drinking, applying cosmetics, or adjusting contact lenses in the laboratory, in order to minimize the potential of ingesting or exposing your mucosal membranes to contaminants that may be on your hands. Always employ standard or universal precautions, which means that you should handle all blood and other potentially infectious materials as if they were known to be infectious. Wash your hands properly and frequently. Furthermore, protect yourself by implementing safe work practices. Follow all lab-specific standard operating procedures and policies. Complete training prior to working with hazardous materials or equipment. Routinely decontaminate work surfaces and adhere to the warning communications through signs and labels. General work clothes or street clothes are not sufficient to protect against hazards and are not considered adequate personal protective equipment. The minimum required attire to enter a laboratory includes wearing long pants that cover the entire leg and closed-toed and closed-heel shoes. Minimum personal protective equipment when working with BBPs include a barrier laboratory coat, safety eyewear such as goggles, glasses, or face shields, and gloves. Review these guidelines for personal protective equipment, including body, eye and face, hand and foot protection. Before entering a research laboratory, what clothing should you wear to protect your lower body? Wear closed-toe, closed-heel shoes to protect your feet. Shoe coverings may be required if large volumes of blood, OPIM, or a blood spill is encountered. As a reminder, you must wear personal protective equipment whenever working in the laboratory. Additional specialized personal protective equipment that may be warranted by a risk assessment includes a wraparound gown or a respirator. Remember to never wear your PPE outside of the laboratory and into public spaces such as hallways or restrooms. When removing personal protective equipment, start by removing your laboratory coat and gloves. Avoid contaminating yourself when removing PPE, and never touch the outside of gloves with bare skin. Wash your hands before removing eye or face protection, and then wash your hands again afterwards. Learn more about proper glove removal and disposal by watching the video. Washing your hands properly is the most effective way to reduce the spread of disease in the workplace. When should you wash your hands? Whenever they are dirty, whenever they become contaminated with blood or OPIM, before eating, after using the restroom, and every time you remove your gloves. The schematic here shows areas that are commonly missed during a typical hand washing. To wash your hands properly, use warm water, generously apply soap, rub soapy hands together for 15 to 30 seconds. Recite the alphabet or sing the happy birthday song twice. Scrub all surfaces of your hands, addressing commonly missed areas such as fingertips and the back of the thumb. Rinse soap from the hands and dry hands thoroughly with a clean paper towel. At minimum, implement standard microbiological practices for laboratories. This includes maintaining personal hygiene, using equipment safely, decontaminating work surfaces and equipment, posting signs, and completing training appropriate to your work. Review the BMBL for safe work practice guidance according to the Centers for Disease Control and Prevention. In summary, identify risky operations that could result in a potentially occupational exposure. Then implement controls to eliminate or mitigate potential exposures. This includes using administrative controls, work practices, and personal protective equipment. When finished with your work, safely remove your gloves and thoroughly wash your hands. With safe work practices in place, it's important that each laboratory develops guidelines for decontamination and disposal of waste generated during operations that involve potentially infectious materials. Users should be adequately trained on emergency procedures, such as biohazardous spill cleanup, and what to do if an occupational exposure occurs. Decontaminate work surfaces and equipment daily, and immediately after working with any materials that may harbor BBPs. It is important to note that not all disinfectants share the same spectrum of effectiveness. Treatment utilizing validated autoclaves or fresh 10% bleach solution are the most effective means to decontaminate a broad range of bacteria and viruses. Please ensure that you are using an effective method of decontamination that is appropriate for your material you are working with. Click on the link to view the antimicrobial spectrum of disinfectants. An affordable and effective disinfectant against BBPs is a 10% household bleach solution, which can be created by mixing 1 part bleach to 9 parts water, or 6 ounces per gallon according to the EPA label for Clorox. Apply the diluted bleach solution to the affected area and let it stand for at least 10 minutes. Remember that diluted bleach loses its effectiveness over time, so prepare a fresh batch of bleach solution and use stock bottles within a year's time. If you're using other chemical disinfectants, make sure to check the label to ensure it's appropriate for your intended use, and that it is an EPA-registered antimicrobial product against bloodborne pathogens. These are products registered as sterilants, tuberculicides, or effective against HIV, HPV. Manage biohazardous waste according to California Department of Public Health Medical Waste Management Act. This includes BBP-contaminated sharps, solid, and liquid waste. All medical waste must be labeled with the biohazard symbol. Sharps includes needles, knives, blades, wires, slides, and cover slips. Place contaminated sharps directly into puncture and leak-proof containers. Do not recap needles. Make sure that you do not exceed the fill line. When the contents reach the fill line, approximately 2/3 full, close and seal the container and place in a waste accumulation site. Red bag waste includes non-sharps, contaminated solid wastes. This includes culture materials, petri dishes, or culture flasks, wipes, and bench paper, contaminated PPE, or any contaminated materials used to clean up spills. Use red bags for biohazardous waste only. Place these bags in a compliant secondary container that is labeled, leak-resistant, and has a tight fitted lid. Do not use hampers or wire baskets, and do not overfill the containers. Finally, do not discard or anything that will puncture the plastic bag. Every year, custodians are injured from glass pipettes or sharp objects that were improperly placed in plastic bags. Red bag waste includes non-sharps contaminated solid wastes. This includes culture materials, petri dishes, or culture flasks, wipes, and bench paper, contaminated PPE, or any contaminated materials used to clean up spills. Use red bags for biohazardous waste only. Place these bags in a compliant secondary container that is labeled, leak-resistant, and has a tight fitted lid. Do not use hampers or wire baskets, and do not overfill the containers. Finally, do not discard of anything that will puncture the plastic bag. Every year, custodians are injured from glass pipettes or sharp objects that were improperly placed in plastic bags. Liquid waste includes blood, body fluids, and semi-liquid materials. Treat liquid waste by decontaminating with an effective and approved disinfectant, such as bringing liquid to a 10% final concentration of household bleach and letting it stand for at least 30 minutes. If disinfected with bleach, and only if there are no other chemicals in the waste, the disinfected liquid can be flushed down the drain with copious amounts of water. However, if it has been decontaminated with another chemical, such as Lysol, iodine, or formaldehyde, do not pour it down the drain. Instead, dispose of as chemical hazardous waste. For more information on hazardous waste, contact EH&S. Ensure that your laboratory has a biohazard spill kit and the lab members have been trained on how to locate and utilize it. Click on the link to review Safety Net number 127, Biological and Biohazardous Spill Response. What to do if a biological spill has occurred. First, you should assess whether or not you are capable of cleaning up the spill by yourself. If the spill is beyond your capabilities, immediately contact the EH&S Help Desk at 530-752-1493. If you can manage the spill on your own, follow the steps outlined here and on Safety Net number 127. First, notify others that a spill has occurred and stay away from the area. Next, locate your biohazard spill kit and don the appropriate PPE. Eliminate any sharps present in the spill by using tongs or long forceps to discard the debris into a biohazard sharps waste container. Then place paper towels onto the spill, followed by an application of the appropriate disinfectant. Once the disinfectant has sat for the appropriate contact time, discard the paper towels in a solid biohazard waste container, using the tongs or long forceps. Clean the area once again with a disinfectant by repeating these steps. Finally, disinfect any contaminated reusable instruments and discard all disposable materials as biohazardous waste. Remove your PPE and notify your supervisor as well as the biosafety office. An exposure is any event where you have a puncture wound from contaminated sharps or direct contact with infectious materials onto the broken or damaged skin or the mucous membranes of the eyes, nose, or mouth. This can happen through splashes, spills, or accidental contact with sharp objects. If any of these incidents happen, follow emergency procedures or exposure to blood or OPIM. What should you do if an exposure happens? First, remove contaminated clothing or PPE in order to minimize further exposure. Then wash or flush the affected area thoroughly for at least 15 minutes with warm running water and a non-abrasive antibacterial soap, if possible, for wounds. If a splash into the eyes has occurred, flush the eyes for at least 5 minutes while avoiding further damage to the eye. Once the exposed area is thoroughly washed and rinsed, immediately seek medical treatment and evaluation. This involves seeking first aid, calling the ambulance and/or transport to the hospital or clinic. Dial 911 for life-threatening emergencies. For non-life-threatening emergencies, inquiries, or exposures, please report to the appropriate treatment facility listed here. Inform healthcare providers of the nature of your research and any biological material involved in the exposure. Next, notify your supervisor or PI. You must report injuries and exposures to EH&S immediately, such as Sharp's injury or serious injuries, as there is a significant financial fine from OSHA associated with any delayed reporting. Finally, make sure to report work-related injuries. This involves completing a report of incident injury form within 24 hours of the injury. For more information about completing the proper forms, please follow the UC Davis Procedures for Injury Reporting link. For more information about where to get treatment or to complete the proper forms, please follow the campus procedures for injuries. In summary, remember to follow procedures for emergencies, reporting exposures, and post-exposure evaluation. This includes washing the affected area for at least 15 minutes, obtaining medical treatment, notifying your supervisor or PI, and reporting work-related injuries, and getting post-exposure evaluation and follow-up services. Review this summary of resources to help follow campus procedures for injuries. The best way to prevent an infection is to become vaccinated against the infectious agent. A key component of the Bloodborne Pathogen Standard is the requirement that all employers offer employees that may come in contact with human blood or OPIM the hepatitis B virus vaccine. If you are at risk of occupational exposure to the hepatitis B virus, there is a vaccine available that is provided at no cost to you. It is given in a series of 3 shots over approximately 6 months with a follow-up evaluation test. The vaccine is 85 to 95% effective at preventing infection and is safe and effective, and you cannot get the disease from the vaccine. For more information, consult with your occupational health physician. While the vaccination is effective and highly encouraged, the vaccination is not mandatory. You may elect to decline the vaccine and continue to work in situations with risk of occupational exposure. If you change your mind, you can still receive the vaccination at a later time. If you decline the offer of the vaccination, you will need to complete the declination form. Receiving the vaccine does not substitute for application of proper controls. Vaccination does not protect against other bloodborne pathogens and is not 100% effective in all people. It is simply an added layer of precaution. In summary, remember to review the written BBP ECP plan and obtain or decline vaccination. Review this summary of resources to help access your campus exposure control plan and obtain or decline the vaccination. In summary, remember to take advantage of tools and obtain answers to your questions involving bloodborne pathogens. This includes contacting the Biosafety Office for answers to your questions and learning more about bloodborne pathogens from the CDC. When you're ready, please complete the following quiz to complete this course.